The first step is to open your web browser. In this case, I'm using Firefox. Then go to drevidence.com. Click the Login button on the top right. Then select Client Access. Next, select Doc Evidence Login. Enter your login information and click Login. You will be taken directly to your database. The landing page provides a general overview of your customized database. The general scope defines the question that is answered by the data in the portal. In this case, we will be looking at localized prostate cancer. Next, the types of studies are outlined with numbers of studies and numbers of comparisons. Click Expand to further view the breakdown. Here, you are able to see the number of treatment groups and subdesigns. Next is the inclusion and exclusion criteria. First, you have your study designs. Next, you have your participants, interventions, comparators, and outcomes, or PICO. These are outlined according to your project protocol. To view your specific project protocol, click the P button on the top corner of the landing page. This project protocol is what you created with a member of the QURE to properly frame your question and understand what you wanted to include and exclude from your customized database. Additional information is listed below the PICO information. The studies list can be found in the Studies menu. The study list provides a list of all of the studies in the database. In this case, there are 15 total studies. As you can see, the first column tells you the author, the second column tells you the study name, and the third column allows you to go in and to view the study summary. To access a study summary, simply click on the magnifying glass. A study summary provides exactly that, a summary of each study in your database. Full text articles are lengthy and hard to understand. What the QURE does is goes through each full-length article and extracts all relevant information for your database. First, you can see the author and the title. Then, within the study profile, you have the study design, the sub-design, the mean follow-up, and other important information. Participant characteristics breaks down all of the information in each full-length article. First column is for open radical prostatectomy patients. The second column is for patients who underwent no treatment. You can see the number of participants, their average age, their PSA score, their Gleason score. PSA and Gleason score are scores particular to localized prostate cancer. Your diagnostic and baseline information will be particular to what your customized database is about. You also have study outcomes. In this case, we are interested in mortality. Mortality is broken down into other reasons, unknown cause, all cause, and prostate cancer, with 2 columns. The first one being for open radical prostatectomy, and the second one for no treatment. You are also able to view a chart. The blue group is the open radical prostatectomy group. In this case, 6% died due to prostate cancer in a mean follow-up of 13.3 years, while 16% of the no treatment group died due to prostate cancer after 13.3 years. The study summary is a good tool to allow you to go in and look at each individual study in your database to better understand the patient characteristics and outcomes. This will allow you to see what kind of treatment is best for you based on other people's experiences. The meta-analysis tool can be accessed in the Studies menu. A meta-analysis pools results from multiple studies to find results of the difference of effect between 2 treatment groups. For example, we're looking at localized prostate cancer. You would want to compare one kind of treatment to another kind of treatment to see which treatment is best for you. Or you can compare one kind of treatment to no treatment to see if it's best to have treatment or to avoid treatment altogether. Step 1 is to choose groups of interest for pooling and comparison. Treatments are organized in the left panel. Click on the triangle to view the nested folders. The second step is to drag and drop the treatment into the appropriate boxes. In this example, we will look at prostatectomy compared to no treatment. Click Submit to view the studies that meet the criteria. There are 8 total studies found. You have the option to choose placebo, usual care, or active control by checking the boxes. You are also able to manually select studies. Click Submit to view outcomes available for analysis and results. The default outcome given is local progression of prostate cancer. To select a different outcome, use the drop-down menus. In this example, we will choose mortality due to prostate cancer. The efficacy statement is automatically generated by the software. The evidence shows that mortality due to prostate cancer, 8.2 years to 20.2 years follow-up, was 58% less likely in those that use open radical prostatectomy compared with those who were using comparator. The comparator in this case is active surveillance or no treatment. A number need to treat statement is also generated. Below the statements is the list of studies used to generate this evidence. This column always refers to the intervention, in this case, open radical prostatectomy. This column always refers to the comparator, in this case, active surveillance or no treatment. The numbers and percentages refer to the total number of patients and the total number of patients who died due to prostate cancer. To exclude a study from analysis, uncheck the box and click Recalculate. A new efficacy statement will be generated. Additionally, the last row provides the average of the given information. What we see in this case is out of 39,217 patients in the open radical prostatectomy group, 586 died due to prostate cancer. While in comparison, out of 21,380 patients who underwent no treatment or active surveillance, 1,066 died due to prostate cancer. The corresponding percentages can be found below these numbers. So we can see that there was a total difference of 3.5% between these two groups. The meta-analysis tool allows you to pool results to better understand the effectiveness of treatments. You can also get back to the study summary by clicking the magnifying glass in the View column.